Okay, today we're going to talk about the 7 most common causes of dizziness and ear problems, starting with the most external causes and working our way to the most internal causes. So the most external cause of dizziness is a vestibular migraine. It's a migraine that affects the nerves of the ear. With that, you tend to get dizziness, but you'll get no hearing loss. And the triggers are typical migraine triggers, so neck tension, food issues, poor sleep, stress, that sort of stuff. Now we actually move to the ear. So the most external part of the ear is basically the ear canal, or what's called swimmer's ear. And that's just an infection of the ear canal. It's very tender to the touch. It tends to be more bacterial than viral because as we get closer and to the brain, our body has more protection against bacterial infections. And it will not affect hearing, or it won't affect dizziness. So it's the external ear. So now we go kind of to the middle ear. Now with the middle ear, we're affecting the eardrum. So we will get some hearing loss, but we are not affecting the things that will cause dizziness. So the middle ear infection can be viral or it can be bacterial, and there's muffling of the ear as the eustachian tubes can be blocked, but you are not getting any sort of dizziness. The next we get to the labyrinth. The labyrinth is made of the cochlea and the semicircle canals. The cochlea is in charge of the hearing, and the semicircle canals are in charge of balance. And together they're full of endolymphatic fluid. Now when this whole thing gets inflamed through a viral or bacterial infection, you will get both hearing loss and you will get both dizziness. Because it tends to be involved with an upper respiratory infection, it can be very severe and consistent vertigo, but will clear up as the viral infection goes away. The next thing that we can get involved is crystals in the semicircle canals. This is benign proximal positional vertigo. So there's no inflammation, there's no infection. There's just crystals in the ear that are moving. This type of vertigo is really aggravated with head position, but is fine when you're not moving. Next thing we have Meniere's disease. And Meniere's disease is kind of an autoimmune or excessive lymphatic fluid in both the cochlea and in the semicircle canals. So you get both hearing loss and dizziness issues. It tends to be a little episodic, so it will kind of come and go, but it's definitely more chronic. The last thing we get is vestibular neuritis, or inflammation of the vestibular nerve. This tends to be definitely viral. Because it's the vestibular nerve, you tend to get really strong and severe dizziness, but it is not affecting the cochlea, so you don't get hearing loss. So it's dizziness with hearing loss. I hope that explanation kind of clears up maybe what's going wrong with you and maybe things that you can do to help it.